Today for Andrea, we're going to have a full face approach to rejuvenation using fillers. And the reason that fillers are going to work so well for Andrea is that her face is really quite thin naturally. But one of the biggest problems with Andrea's face is that her chin is a little bit underdeveloped. And as we get older, we'll lose definition of the chin and jawline. And so if you start off from a position where you were already a little bit recessive, then that really predisposes you to forming jowls earlier on. So we're going to start off by really correcting the proportions of her chin in relation to the rest of the face. And then from there, we're going to move on to restore the volume loss in the cheeks, the jawline, under the eye area, and around the mouth. So you can see when we've brought the projection of the chin forward, it has made this sulcus in here look deeper. So we're going to move on next to restore the height of the chin along here, and then we're going to come into this area to build that up and make the chin blend in with the lower lip. How does this feel?
It's okay.
And now the chin is probably one of the more sensitive parts. So when I place the filler up here, you can sometimes feel it in the inside of the lip. That's quite normal. So far, we have brought the projection of the chin forward, we've restored some of the vertical height to the chin, and we've blended the chin into the lower lip and the labiomental sulcus. And if Andrea just sits forward, you can see that that's already helped us to reduce some of the sagging in the lower face. Next, we're going to move up to the cheek. Now that we've corrected the chin, we're going to move up to the cheek. And we're going to focus on restoring a little bit of lateral width to the cheekbone, restoring some of the fat that's been lost from the lateral cheek fat, and we may even come down and do a little bit under the jawline to help us get a little bit more retraction to the jowls. Okay. See how that's looking. Okay, good. And just turn slightly towards me in a second. Okay, and then lie back a wee minute again, please. So, one of the important things that we don't want to do is create strong cheekbones that Andrea never had naturally. So we're trying to restore volume only to where it's been lost. It's coming together really nicely. So when I'm filling the cheek here, what I'm focusing on doing is the lateral width of the cheek. So as we get older, the face becomes narrower and longer. So we're restoring the width of the cheek to make the face look a little bit more like a heart shape, youthful heart shape, rather than focusing on creating really heavy, chubby cheeks. And then sit forward for me for a second, please. See that? So I'm just going to do this with you sitting up there, if that's okay. Good. Give me a wee smile, please. So we're just going to do a little bit to the jawline, at the back of the jaw, to give us a little bit more vertical height to the jaw angle, which will help us also to reduce the jowls. In the middle section of the cheek, I'm going to use a sandwich of fillers. So in the deep layer, I'm going to use a slightly thicker filler, but I'm really apprehensive about creating chubby cheeks, so I'm going to use a slightly thinner filler closer to the surface of the skin, just to avoid the bulky look. By supporting the cheek in here, it helps us to also lose the eye bags under the eyes. Good. So now we're getting into the more superficial part of the cheek, and we're just going to plump this up with a little bit something softer. Not that all the fillers we're using aren't soft, but this is just a little bit better close to the surface, because the last thing we want are hamster cheeks. Okay, and just relax back a wee second. Yeah. Using some of the softer filler, I'm going to go up here, right into the eyelid, right on top of the bone at the corner of the eye. Just building that area up to blend in the appearance of the bags. So one of the really important things to do is also assess the face in motion when the patient's smiling. We need to make sure that what looks good when the face is at rest also looks good when the patient smiles. As in everyday life, what we don't want to see are the patient smiling and then the cheeks bunching up or things starting to look unnatural in motion. So we need to be very conscious of how things look in all directions and in a variety of different circumstances. One of the things I hate about fillers is when they're overdone around the mouth area. So I always try and minimise the amount that I put into these folds, just because I don't like that bulky look around the mouth. I want this to look really nice and natural. So the lips will just look a wee bit puffy to start with. Sorry. No. Sorry. You okay? The lips are just a wee bitty puffy. They will look fabulous when they settle. Okay, ready?
Oh my god. Oh my goodness. It's just totally different, isn't it? Oh my goodness, oh my days.
Get all of this.
The difference, and there's no lines coming down. I can't believe it. And it looks so natural, doesn't it? It doesn't look, it just looks like me a few years ago. That's what we wanted.
Yay!
That's amazing.